So this is, I'm just telling how we came in here, Dr. Anand, Dr. Maitri. There's a lot of training behind where we are, and we use the fluoroscopy and ultrasound. Then we also use the patient's own cells. All the musculoskeletal conditions throughout the body. It can start from the neck itself. You can have cervical spine, headaches, spondylosis, radicular symptoms. Then, as I said, you can go to thoracic spine. We have patients with some of those issues. Shoulder arthritis, rotator cuff tears, labral tears, common. Younger people or athletes, it's very common. And then wrist and thumb arthritis also we see in some patients. Low back, I'm sure you see most of your patients have low back problems, sciatica problems, and disc problems, herniations. And the hips but the most common of all these is the knees, right? I mean, if you see 10 patients, almost half of them are knee patients, but we see all variety of patients. So you can even ankles. So basically most of the joints, ligaments, tendons from the top to the bottom can be treated depending on when they're coming to us, how far they're gone, what is the degeneration. That depends the next category. We want to categorize, who's a good candidate, who's not a good candidate. But all these areas can be treated with PRP or stem cells. You hear a lot of PRP mainly doing the knees. Everybody talks about it because, as I said, not everybody's trained to do a wrist injection. They're not trained to do a labral tear. So obviously you don't hear that thing, but we've been doing it for so long. So all these have applications, all these joints and ligaments based.